Type 1 diabetes is a lifelong variation of the disease that typically takes hold in childhood or adolescence. Today, our group is going to talk about type 1 diabetes. This is the concept map of type 1 diabetes. You can find pathophysiology, risk factors, signs and symptoms, complications, and clinical treatment. We will discuss further information from the following slides. Here now is Kat to start with pathophysiology.
Pathophysiology. Type 1 diabetes occurs as a consequence of an autoimmune assault on the beta cells in the pancreas. It is developed through elicitations of the immune system against beta cells antigens and elicitation of pro-inflammatory response. After antigens-presenting cells present beta cell antigens to the immune system, chronic immunological response occurs due to inefficient regulations of immunological reactions, which leads to destruction of beta cells. Beta cells act as glucose sensors and regulate and produce insulin. They detect rising blood glucose levels and respond by releasing insulin to maintain a blood glucose level of 4 to 7 millimoles per liter. A progressive reduction in the number of beta cells results in suboptimal amount of insulin being produced to maintain blood glucose homeostasis. Inefficient or without insulin, glucose accumulates in the bloodstream rather than entering the cells. As a result, the body cannot use glucose for energy. Glucose remains in bloodstream cause a rise in blood glucose levels. In addition, the high levels of glucose that remain in the blood cause excessive urinations and dehydration, and damage tissues of the body. The process of reduction in the number of beta cells occurs slowly over several years. However, it is estimated that at the time of diagnosis of diabetes, the beta cell mass will have been reduced by 70 to 80%. Because of this decline in beta cell mass, the persons with diabetes is no longer able to control their blood glucose levels. Left undiagnosed, this often results in the person becoming unwell over a short time with the potential to develop diabetic ketoacidosis and develop other complications in the long term.
There are several risk factors which can cause type 1 diabetes. The first one is autoimmune conditions. Type 1 diabetes is an autoimmune condition because it causes the body's immune system to turn against itself. There are other autoimmune conditions that may share a similar human localized antigen complex, and therefore, having one of those disorders may make you more likely to develop type 1 diabetes. The second one is genetic susceptibility. Research has proven that if someone in your family has type 1 diabetes, then you are most likely to have the type 1 diabetes mellitus conditions at some point in your life. Genetic susceptibility testing for type 1 diabetes involves the use of multiple genes. And the next one is intestinal microbiota. Some of the environmental factors for type 1 diabetes, such as early childhood diet and use of antibiotics, are intertwined with the development and function of the human microbiome. Gut microbes influence lipid and glucose metabolism, as well as immunity and systemic inflammation outside of the intestine. And the next one is beta cell stress. Beta cell stress, such as rapid growth, overweight, puberty, and glucose overload, it not only increases insulin resistance leading to increased demands on the beta cells, but stress can directly influence the immune response through increased cortisol concentrations. The next one is viral infections. Researchers have found that certain viruses may trigger the development of type 1 diabetes by causing the immune system to turn against the body, instead of helping it fight infections and sickness. Viruses that are believed to trigger type 1 diabetes include German measles, Coxsackie, and mumps. The next one is age. Immune-mediated diabetes commonly occurs in childhood and teenager years between 5 to 21 years old, but it is also possible to occur at any age. And the next one is ethnicity. Certain ethnicities have a higher rate of type 1 diabetes. In the US, Caucasians seems to be more susceptible to type 1 diabetes than African American and Hispanic Americans. Chinese have a lower risk of developing type 1 diabetes, as do people in South America. The last one is geography. It seems that people who live in a northern climate are at a higher risk for developing type 1 diabetes. Conversely, people who live in southern climates, such as South America, are less likely to develop type 1 diabetes. And along the same lines, researchers have noticed that more cases are diagnosed in the winter in northern countries. The diagnosis rate goes down in the summer.
Type 1 diabetes is a disease in which pancreas stops making insulin. Without insulin, glucose cannot get into your cells, and your blood glucose levels are too high, which is called hyperglycemia. Hyperglycemia causes some problems. First, hyperglycemia can cause vasoconstriction by reducing the levels of the powerful vasodilator. It can induce the kidney's blood vessels to become narrow and clogged, and kidneys are unable to retain glucose. As a result, it leads to glycosuria, which is an excess glucose in the urine. Glycosuria can develop polyuria through osmotic diuresis. When glucose levels are so high that glucose is excreted in the urine, water follows the glucose concentration passively, leading to abnormally high urine output. That is the process from glycosuria to polyuria through osmotic diuresis. Subsequently, polyuria could cause dehydration and even polydipsia by passing large amounts of urine. Also, vasoconstriction by hyperglycemia can cause poor circulation. It leads to slow healing wounds. Second, hyperglycemia can cause fatigue because cells cannot get glucose as energy by lack of insulin. It means your body is unable to get energy. Diagnostic tests for diabetes are currently recommended in symptomatic patients. First, fasting visual check. Patients cannot intake food or fluid except water for 8 hours. If the fasting visual is greater than or equal to 7 millimole per liter, it's considered diabetes. Second, random visual check. This visual can be taken at any time during the day. If random visual is greater than or equal to 11.1 millimole per liter, it's considered diabetes. Third, oral glucose tolerance test, which is called OGTT. For this test, patients fast, then check fasting visual, then drink 75 gram oral glucose given, and after 2 hours, we check visual. If the result of OGTT is greater than or equal to 11.1 millimole per liter, it's considered diabetes. Lastly, HbA1c test, which is also known as glycated hemoglobin test. This test is to find out average glucose level for the last 2 to 3 months. If this VGL is greater than or equal to 48 millimole per mole, it's considered diabetes. In terms of asymptomatic patients, if elevated VGL values are detected in these patients, repeat testing, preferably with the same test, is recommended on a subsequent day to confirm the diagnosis.
Clinical management. Healthcare professionals who should be involved in diabetes clinical management are as follows. Primary care doctor. Primary care doctor is often be the person who diagnoses patients' symptoms, provide routine medical care, and diabetes checks, including physical exams, prescription for medication, and lab tests for type 1 diabetes, such as random blood sugar test, urine test, fasting blood sugar test, and oral glucose tolerance test. They also generally make a diabetes plan to help the patients by referring patients to the diabetes specialist for ongoing treatment. Endocrinologist. When primary care doctor needs more support to treat patients' diabetes, or when they may have an increasing risk of developing complications, endocrinologist is referred as a diabetes specialist. They provide expert advice on the management of diabetes. More specialist. Following experts should be also involved to monitor and treat any complications related to type 1 diabetes. Dietitian. To manage patient blood glucose, healthy meal plan is important. Dietitian can help create a diabetes meal plan for patients that meet their needs and likes. They can suggest right amount of daily intake to manage blood glucose level. Pharmacist. Pharmacists can help patients understand their medications and manage any side effect they may experience. They can also give advice to the patient about supplements for possible interactions with any medications they take. Diabetes educators. Any health experts can be diabetes educators. They teach patients how to control diabetes, how and when to take medications, and how to monitor blood glucose level to avoid or delay any serious health complications. Accredited exercise physiologist. Accredited exercise physiologists specialize in clinical exercise intervention. They plan individualized physical activities for the patient and suggest target range of blood glucose level based on their daily schedule, meal plans, and diabetic medication. Psychologist. Psychologists can help patients who are having troubles dealing with the psychological side of diabetes. This is important as stress can raise blood glucose levels. Social workers. Social workers can help patients find financial aid for diabetes treatment and community resources. Due to its complications and risk factors, a comprehensive healthcare team involvement based on an individualized care plan should be provided in the clinical settings. Medication and treatment. Basal insulin is a long-acting insulin. Sometimes it's called as background insulin, which regulates glucose level between meals and is released throughout the day, whether or not a person eats. But it is not enough to cover glucose spikes after mealtime. Bolus insulin. Bolus insulin is a rapid-acting or mealtime insulin, which is released by the pancreas in direct response to the ingestion of food in order to manage the rise in blood glucose that immediately follows. Basal bolus therapy. Basal bolus therapy is a combination of a long-acting basal insulin with a rapid-acting insulin at mealtimes. It more closely mimics how the body's natural insulin works throughout the day. So for type 1 diabetes, basal bolus insulin therapy must be included in the treatment. Pramlintide. Pramlintide is injectable amylin analog. It works with insulin in patients with type 1 diabetes who have failed to achieve desired glucose control despite optimal insulin therapy. When using pramlintide, bolus insulin dosing should be reduced to minimize the risk for severe hypoglycemia. Continuous subcutaneous insulin infusion therapy. Using insulin pump to adjust basal insulin rate correspond to patient's liver function. It helps to minimize a pre-breakfast blood glucose increase. Hypoglycemia is markedly less frequent than during intensive injection therapy. Medical nutrition therapy. Medical nutrition therapy can help optimize glucose control, providing calorie plans to meet metabolic demands and individuals' food preferences. It should fit within the acceptable macronutrition distribution range. Above all, health professionals should not forget the importance of patient education on insulin therapy and how to monitor blood glucose and ketone level to avoid potential risk of type 1 diabetes.
Complications of type 1 diabetes are all linked to inefficient blood glucose management. There are short-term complications and long-term complications. One of the common short-term complications associated to type 1 diabetes is hypoglycemia. There are three levels: mild, moderate, and severe. And severe can rarely cause a coma and even death, so early recognition is highly important. Hypoglycemia can be caused by many reasons. such as injecting too much insulin, or improperly planned insulin management, or unhealthy diet. Also, consuming alcohol may hinder the liver from discharging glucose, which can drop your BGL. Signs and symptoms of hypoglycemia are rapid heartbeats, sweating, paleness of skin, anxiety, numbness in fingers, toes, and lips, confusion, headaches, and so on. Another short-term complication is diabetic ketoacidosis, which is also called DKA. It can be the first indication that a person has type 1 diabetes and can be a serious complication of lack of insulin. DKA happens when your body runs out of insulin. You cannot use glucose properly or effectively, and your body starts to use fat to get its energy. When fat is broken down by the body, ketones are released. If too many ketones build up in your blood system, it will make your blood acidic, and finally, it may lead to DKA. You may experience frequent urination, extreme thirstiness, abdominal pain, cold skin, confusion, weakness, and weight loss because you are using fat as an energy source, and also fruity smell on breath, and this is the smell of ketones being released from your body. Now, let's look at the long-term complications. Uncontrolled BGL can damage the body's small blood vessels, which can cause microvascular complications. So if the damage is in your lenses, it may cause cataracts. And if it's in your retina, it will cause retinopathy, which is more common complications. And they both can cause vision impairment. To avoid this, keep BGL under control and have dilated eye checkup annually. And there's diabetic nephropathy, kidney problems. If the patient's BGL is controlled poorly, it will eventually cause kidney failure, which means it will be unable to clean and detoxify the blood, and it may lead to dialysis and/or a kidney transplant. To prevent this situation, you can have an annual test for microalbuminuria. It shows early signs of kidney problems. This test measures how much protein is in the urine. And also, the problems can be presented in your nerves, which is called diabetic neuropathy. There are 4 types of diabetic neuropathy: peripheral, autonomic, proximal, focal. Diabetic peripheral neuropathy is the most common form of nerve damage. It often affects the nerves going to the foot, and it may cause losing sensations in the foot. You may not realize soreness in foot due to the peripheral nerve damage, so the sore can become uninfected. And you may eventually require a foot amputation so that you can keep the infection from spreading further. Lastly, uncontrolled BGL can also damage the body's large or medium-sized blood vessels, and it may cause macrovascular complications. If the large blood vessel is damaged, it may cause a buildup and potentially leading to ischemic heart disease, cerebrovascular accident, or peripheral vascular disease. And the patients with diabetes risk 10 times more than those of people without the disease. To prevent these complications, manage BGL, make heart-healthy choices such as no smoking, control BP, and cholesterol levels. Moreover, in females with type 1 diabetes, they tend to have lumpy breasts and to undergo premature menopause, which increases their risk for cardiac problems. This is a reference list. Thank you for listening.